Hi, I'm Dr. Emma Wedgeworth. I'm a consultant dermatologist and I work in Harley Street alongside the team with Dr. Sam, Dr. Rakesh and Dr. Tracy. Now it's summer, we're all getting our strappy tops, our dresses on and our bikinis. But what happens if you are suffering from acne, butt knee, chest acne, any of that sort of aspect? And it's actually hugely common. Because in terms of your skin, oil-producing glands, your sebaceous glands, are densely populated on your face, on your back, your chest, and they can occur in various different areas. So it's actually very common for us to see changes on the chest and the back, and it's a real pain. Now, there are lots of different types of spots, bumps, and blemishes that can happen on the back and the chest, and it's important to actually realize what type of changes you're getting, because it's not all acne and breakouts. So you can get the same sort of blemishes that you get on your face. You can get congestion, you can get blackheads, you can get deeper, lumpier spots. But there's also a type of folliculitis, which is an inflammation of the hair follicle, which can happen on the back and the chest. And that's something called pityrosporum folliculitis. So have a good look at the changes if you are experiencing changes on your back and chest. If it's lots and lots of tiny little itchy red bumps with tiny little pussy aspects, which gets worse in the summer months, you may be suffering from something called pityrosporum folliculitis. And that is a yeast infection which can happen within the hair follicles. The sort of treatment for that would be an anti-yeast shampoo. So you could get something like Nizoral shampoo, you put it all over the back and the chest, leave it on for 1 to 2 minutes and then wash it off in the shower, and do that for a couple of weeks, and then you may have to use that as maintenance every couple of weeks. So that's one thing that is not acne. It looks a bit like acne, but it's not actually acne. But what about if you are getting congestion? So really, really common to see blackheads, particularly around the chest. You might get a few deeper and lumpier spots which happen on your back, and that is the same sort of process that can go on if you break out on your face. So what can we do about that? Well, the first thing is to make sure you're not using anything that can be making it worse, because it's actually really, really common. You know, you're getting ready for summer and you want to moisturize a bit more, and you're putting lots of oils or like cocoa butter, that sort of consistency of moisturizer, and that can really block your pores. So steer clear of the sort of oils, cocoa butters, that sort of aspect, and go for a nice, light, non-comedogenic, non-pore blocking moisturizer on your back and chest. And that might be something like CeraVe, for example. CeraVe lotion is a great one because it comes in quite big bottles as well. The other thing in the summer that can really block your pores is fake tan. And if you've got a little bit of blockage anyway within your pores, so sebum, which is what sticks in the pores, is made up partly of keratin. Fake tan loves clinging to that. So actually what you can find is that it clogs up all sorts of areas around the back and chest. To try and avoid that, think about the sort of consistency of your fake tan. If it's something that's got a lot of different sort of natural ingredients or oils in it, then you can actually switch it up to something that's a little bit less pore blocking, and leave it on just for a couple of hours, because actually that can reduce the chance of it actually getting in and blocking the pores, and then wash it off. So sort of short contact. So those are the two things that I tend to find make it worse. But what happens if you've switched up everything and you're still getting these pesky breakouts in your back and chest? Well, one challenge when I'm treating like body acne, and that can be in any sorts of areas, so back, chest, sometimes bottom, is that it's a bit of a larger area than your face. And so the sorts of creams that we tend to use on the face come in tiny little tubes, and they're not always suitable, and you can't get them. Like, it's a real hassle to be able to actually get them onto the back. So one thing that I find quite useful in body breakout is washes. And you can use something in the shower first of all, because actually these are designed with really good spreadability. They come in quite big tubes. And there are a couple of different ones that I like. So I really like the Effaclar Micro Peeling Wash by La Roche-Posay. That has a combination of 2% salicylic acid and LHAs within it. And if you're in the shower, what I would advise is that you just damp the area, apply the wash to the skin and leave it on for a couple of minutes, because that's going to ensure that you get sort of maximum penetration of the salicylic acid and the LHA, the lipohydroxy acid, into the hair follicle to try and unclog it and actually reduce breakouts and blemishes. It's quite a nice, gentle formulation. And that's something that you can start off maybe just using a couple of times a week if you're a bit sensitive, up to every other day, and then up to daily use in the shower. The other wash that I think can be really helpful is the Benzyl Peroxide, the 5% acne side wash. But you do have to make sure that you carefully wash this off, because otherwise you're going to bleach all your clothes and towels and you're not going to thank me for this. So again, damp the skin. Try not to make it too hot, because the benzyl peroxide can sometimes irritate a little bit. Apply it, leave it on for a couple of minutes and then wash it off. And that can be a really useful one to unclog pores. Now, the other things that can be useful for backs, chests, bottoms, any sort of body acne is a spray. And Paula's Choice does a salicylic acid spray, which can be useful. And Says Derma does a spray lotion called Azelaic, which is a little bit of azelaic acid and a bit of salicylic acid. You want to spray that into a cotton pad and sweep it all over the affected areas. And again, that sort of spreadability, it's much, much easier to use. Rather than the smaller sort of tubes that things come in. Okay, so what happens if you have tried all of these sort of over-the-counter things, but actually your body acne is not improving? Well, sometimes I tend to find that actually in body acne, we do need slightly greater sorts of treatments. So it may be that actually you'll need something like a oral antibiotic, because sometimes, particularly if you're getting on the lower back and the upper back, it's just too difficult to get treatments all over. So that might be a course of oral antibiotics like linocycline for about 3 months. If it's quite severe, deep lumpy changes and you've tried a few different things, we might be thinking about other treatments. If you're a woman, it might be something like spironolactone, occasionally thinking about something like Roaccutane. It can be possible to try and get creams on, and the creams that I tend to use on the back and the chest is often different, adapalene, because it comes in quite big tubes. And what I tend to advise is that you use about 2 to 3 fingertip lengths use on the back, and you might want to mix it in with moisturizer, because again, the spreadability can be much better if you've got it in a sort of moisturizing base. So you can try that first of all if you want to try and avoid tablets, but sometimes, particularly if you're getting quite deep and lumpy changes, or they're starting to leave some marks on the back, because that can be a real problem, particularly if you've got pigmented skin. It can often leave either brown marks, or it can sometimes leave even whiter marks. So you want to get in and treat effectively as soon as you can. But essentially, if you're trying this summer to sort out your back acne or your chest acne or whatever it may be, start simply. Sort out your products. Don't use lots of pore blocking ingredients like butters, oils. Stop with the fake tan if you're finding that's a problem. And then start with one of the washes that I talked about, either something like salicylic acid or benzyl peroxide, and see if you can get that really nice and clear to enjoy all of your summer outfits. So I hope that was really helpful. Leave your comments below. Any questions, let me know, and have a fantastic summer. Bye for now.